having hip replacement surgery, the last thing you want is to get an infection while you're at the hospital or at the surgical center. According to the World Health Organization, as many as 1 in 10 people get some type of healthcare associated infection. Let's be sure that is not going to be you. Hi, I'm Pamela, and I had a total hip replacement almost 3 years ago, which is why I decided to tell you that I'm now the Bionic woman. In this video, I'm going to tell you what it is that I did the day before my surgery and the morning of my surgery to try and minimize any chances of me getting an infection during the surgery. Spoiler alert, I will tell you, fortunately, I did not get an infection. However, I know at least 2 people here in the United States, so we're not mostly a third world country, but I know people who did get infections as a result of joint replacement surgery. Just to let you know, I'm not a medical professional. I'm a patient just like you. I'm not giving you medical advice in this or any of my other videos. I'm simply giving you information in all of my videos so that way perhaps when you talk to your medical professional, maybe you'll have a different set of questions to ask that particular person. Before my hip replacement surgery, my doctor gave me a very specific protocol to follow, which included 2 prescriptions, which should hopefully have minimized the chance of me picking up any type of infection while at the surgical center or bringing it from home. Before I get into that, if you've not yet subscribed to my channel, now's a good time for you to go ahead and do that. Also, be sure that you follow this video all the way along to the end, because at the end of today, I will tell you what my next video is going to be. The protocol my doctor gave me started the day before my surgery. And the very first thing I was instructed to do was do my laundry. That included the clothing, including my socks, including my undergarments that I was planning on wearing the morning of my surgery on the drive to the surgical center. The next thing on the list from my doctor was the night clothes I was planning on wearing to bed the night before my surgery. Those all needed to be fresh straight out of the washer and dryer. Then the final thing on the list was actually my bed sheets, the sheets I was planning on sleeping on the night before my surgery. You may kind of start to figure out the theme here, which was basically any type of material that was going to be touching my body needed to be absolutely as clean as possible starting the night before my surgery and into the morning of my surgery. I also had 2 prescriptions that I was supposed to use as part of this kind of like cleaning my world protocol. The first one is kind of a body wash called Hibiclens. That is a liquid antimicrobial skin cleanser, and I was instructed to take a shower, wash my entire body, including my hair, with this jar of soap. Now, again, as a lady, I wasn't really wild about this idea. I have very dry skin. I like to have my girly lotions. They smell good. I like my soap. I like my shampoo. I wasn't allowed to use any of that stuff. I was only allowed to use this Hibiclens cleanser. I also was not allowed to use any type of deodorant. Surprisingly, I found the Hibiclens was not irritating at all. It actually felt a little bit nicer on my skin than some other soaps that I've used in different places, so I was pretty happy about that. The other prescription I had was called Mupirocin. I think that's how you pronounce it. This was a topical antibiotic that had some little nasal swabs, and what I needed to do was kind of put the swabs in the bottle and then kind of swirl it around in each of my nostrils. The purpose of that medication, according to its literature, was to reduce or eliminate bacteria that could potentially cause staph infections, including MRSA. This whole protocol, including the Hibiclens and the nasal passage one, which I'm not going to try and pronounce again because for whatever reason I don't seem to be very good at that, that is referred to as a pre-surgical decolonization protocol. That's a fancy way of saying try to wash off all of your germs and don't pick up any new ones before you get to the hospital. So I had to take that shower, washing my hair, washing my body, not using deodorant, the night before my surgery. I had to go through the exact same protocol the morning of my surgery. For my surgery, I had to report to the surgical center at 5:45 a.m. I wanted to be the first surgery of the day, and I actually touched on that in another video that I did as part of this channel. So I will put a link to that somewhere in the top of the video here and also in the notes below this particular video. If infection is something that is a big concern of yours beyond whatever protocol your doctor might be offering to you, talk to your doctor about that. There is a chance that an infection can actually show up months, if not years, after your surgery. I didn't even know that until I read a comment that somebody put under one of my other videos where they mentioned that that can be a real risk. At the time that I'm creating this video, my channel is still small enough that, as you can see, I do read and respond to every single comment people put under my videos. So this is a good time if you have questions to put your questions in the video. I will do my best to answer them. Or if you have thoughts or an experience that might potentially help some other person out there, put that information in the comments below the videos too. I know people really value the comments that other people, just like me, just like you, offer them when it comes to preparing for their hip replacement surgery. If you haven't yet subscribed to my video, go ahead and do that now. Click the little bell icon. That way you'll be notified each time I release a new full-length video. At the beginning of this video, I promised I would tell you what my next video is going to be about. And in that one, I'm going to go over a whole list of questions people ask me in the comments below my video, because I know that the questions other people asking might be the exact same questions that you have. Finally, if you like a shirt like this, I actually have got a coffee mug too, just because I like the whole idea of a bionic woman. I bought this on Amazon, and in the notes below the video, I'll put a link to this shirt as well as a couple other items that might be helpful for you as well. Until next time, take care.